Director of Public Health, Catherine Wells, Public Health Authority, Dr. Ron Cook, Director of Pharmacy for United Supermarkets, Tim Purser, and Lubbock Mayor, Dan Pope. We start today with Catherine Wells.
Thanks, Lacey, and good morning, everyone. We continue to have some good news associated with our case counts. Our case numbers continue to be low. Last week, I said that our case numbers or new COVID cases were hovering around 100 cases per day. We are now averaging around 60 new cases a day. And also the number of people hospitalized has also decreased. This is all good news for our community, and I want to thank you all for following all of those important public health messages, such as wearing your mask, social distancing, and practicing good hygiene. We need to continue this as we work to increase the number of people in our community who are getting vaccinated. We're seeing an increase every day in the number of people who we have now vaccinated, and we are vaccinating at a faster rate than we have new cases. And this is only get us closer to herd immunity. Our clinic numbers continue to remain strong, and there continues to be strong demand. We still have many residents who are both in group 1A or 1B, and we need to focus on getting all of them vaccinated. As a reminder, those who are in 1A, those include individuals who are medical personnel, home health, individuals living in long-term care, those working in long-term care, and our first responders. And then our 1B group is those individuals who are over 65 or those who are younger and have an underlying health condition that could cause severe outcomes if they were to catch COVID. And those include things like cancer, chronic kidney disease, COPD, heart conditions, organ transplants, obesity, and diabetes. We also are encouraging women who are pregnant to talk to their provider and get the vaccine. They do qualify. And with that, we're very excited to continue to hold our vaccination clinics at the Civic Center. Don't let this cold weather stop you from coming out if you do have an appointment. We don't have any lines outside. All of the lines have been moved inside, and we're getting people through as quickly as possible. So if you have that appointment, don't cancel. Come on out, even in the cold weather, and make sure you get that vaccine. With that, I will pass it over to Dr. Cook.
Thank you, Catherine. I appreciate that. And again, thank you for all the hard work that you're doing down at the Civic Center. And let me say thanks to the volunteers that are coming out and helping us. We couldn't do it without you. So thank you for that hard work. Let me thank the good citizens of Lubbock as well, because of your efforts of social distancing and wearing your mask and washing your hands, our numbers are dropping and our hospital numbers are well below 10% now. This is fantastic news. Please don't let your guard down. We still have a long ways to go, but this is great news. I'll give you a little update about the mutations of the virus. That's what viruses do. Viruses mutate. That's how they avoid slowing down, and that's how they avoid vaccines and stuff. However, the good news is our vaccines are covering those mutations at present. And so we've got to get people vaccinated so we can shut down the virus. And the only way the virus can mutate is if it continues to replicate. And the way we stop replication of the virus is stopping the spread of the virus from individual to individual. Thus, that's why you have to get the vaccine. And in the meantime, when it's your time to get it, please come get it. But if you're not on the schedule, please continue those social distancing measures and hand washing and facial coverings. That's how we prevent the virus from spreading. The UK variant that you may have heard about is here. It's not in Lubbock as far as we know, but it is in Texas. It's more infectious, about 50% more infectious than the other original virus. There's also a South African virus that we're concerned about. it's more infectious as well, but it is avoiding the AstraZeneca vaccine. You may have heard that in the news, that it's not, the AstraZeneca vaccine is not very effective against that virus. We are not using the AstraZeneca vaccine. We're using Moderna and Pfizer, and both of those vaccines are covering these mutations very well. So please come get your vaccine. There's another study in the news recently that talked about people who have dementia. This is an age group that we're vaccinating presently, but people with dementia are about twice as likely to get COVID. So please, if you have a loved one, let's get them signed up to get them in for the vaccine. As Catherine said, we're still in phases 1A and 1B. Please come get your second dose if it's time to get your second dose. Remember, that's a little booster shot that gives you that really good immunity up to 95%. So make sure you come get your second dose. I always want to remind you that if you are positive and you are 65 and older, and you have some what we call comorbid condition, that's uncontrolled diabetes, hypertension, some immune disorder, cancer, as Catherine said, chronic kidney disease, obesity, you qualify for this antibody infusion. It's still happening. We're still giving these drugs to help keep you out of the hospital. It's still over at the Grace Hospital, the former Grace Hospital. It's at 50th and University. So please take advantage of that if you do qualify. The last thing I want to talk about is Valentine's Day. It's on Sunday. I've talked about being outside, being in your garage, being in the open air. That's probably not going to happen given this cold weather. But Valentine's Day is on Sunday. So grab you some chocolates, grab you some flowers, and give them to your loved one. Write a little Valentine's Day card and give them to your loved ones. Remember, everything in moderation. So chocolate is not a bad thing. Dark chocolate is better. It has more antioxidants in it that give you heart healthy, but a whole box of chocolates is not good for you. So everything in moderation. You can't get COVID from flowers. You can't get COVID from chocolate, and you can't get COVID from your Valentine's Day card. So share those with a loved one. Have a great weekend coming up. Have a beautiful Valentine's Day. And please stay safe. Wear your mask, socially distance, and wash your hands. Let me introduce you, Mr. Tim Purser. He is the Director of United Pharmacies. Mr. Purser, off to you.
Thank you, Dr. Cook. Great advice for us all with Valentine's approaching. So thanks for that advice. Just wanted to thank everyone for allowing us to be a part of this panel. United Supermarkets, our pharmacy teams and store teams are so excited to be a part of any collaborative effort that improves the health and wellness of our communities. And our teams are just really stoked to do what they can to help improve that and help deliver vaccine to our community. We have worked hard to get dose allocations and to ensure that we try to provide vaccine doses to our guests in scenarios where they're very comfortable and where they're used to coming, i.e. to our grocery stores or to our pharmacies. We've had great success with getting those doses to our guests and in our locations. And in addition, we've really attempted to try to have outreach clinics that were more targeted in some of the underserved communities of our city. We've had last week we had very targeted clinics in East Lubbock and in North Lubbock, and we've had great turnout for those locations. We've been able to get doses into those communities that might have had some underserved doses that weren't able to get to those. So we're very excited to be able to help all parts of our community. Tomorrow we have another such event scheduled at the Hodges Community Center here on University, and we have scheduled all those appointments at this point. But we continue to look for opportunities where we can help access to vaccines and to doses throughout our community. So we're very excited. Our teams are very excited to continue those efforts. With that, I'd like to pass it over to Mayor Dan Pope.
Good morning, Tim. Thank you so much. Thanks for what you guys are doing at the United family, and we really, really appreciate your efforts. Let's start this morning with the way we normally start. Let me share our updated data slides with everyone. Okay. This is a really good news slide. Dr. Cook spoke to this. It's our hospitalization rate. You can see that we're now not only 7 days below 15%, we're 7 days below 10%. We're on a very good track here. We hope to continue in that same vein. Catherine talked about this. The distribution of our new cases is very similar. It's just there's many fewer of them. About I think if you want to get down to the details, I think 57 new cases on average for the last week. See the hospital bed capacity. This is good news. This is what happens when we get people out of the hospital from COVID and safe at their homes, not having the new cases. And finally, and where I'd like to spend most of my time is just the vaccination results. Remember that we're reporting this on a daily basis. You notice that the orange line and the blue line are becoming closer to the same size, and that's as it should be. Remember that this is the first week that we are vaccinating, or that the folks that back up. Our supply grew slowly. We've been stable with 5,000 or more doses now for 4 weeks. So the folks that are due for their second shot are equal to those that are getting their first shot this week. So we should do about 10,000, roughly right this week. And you see that yesterday's results on the far right of this screen. Okay, back now. I want to make a couple comments. I want to underscore something that Ms. Wells said. Please don't let a bit of cold weather get in the way of your vaccine. If you've got it scheduled, we've made conditions such that you can wait inside the Civic Center. You're not going to have to wait much anyway, but you can do it safely. We want to make sure you get your vaccine. Remember, this vaccine is safe and effective. Dr. Cook talks about a lot of different words that some of us have a hard time following. Remember that on a normal year, the flu vaccine that many of us get is often 30–40% effective. We're talking about vaccines, the ones we're giving in Lubbock today, in excess of 90% effective. So please, when you have an opportunity, if you qualify in 1B, let's get you signed up. When you do have an opportunity, please, let's get that vaccine. Lubbock is the 18th largest county. Lubbock County is the 18th largest county in the state. Among the top 20 counties in the state, we lead the way at over 31% of our eligible population having received the first dose of the vaccine. It's something that I think should make all of us rightfully proud of the work that's going on. And it is a team effort. It's Ms. Wells and her team. It's Lubbock Fire and Rescue led by Chief Fogerson. But it's a lot of great volunteers, school nurses, medical students, faculty members from the Health Science Center, Covenant at UMC, our church groups, retired nurses. I could go on and on. It's remarkable. The cure for a bad day is to go and walk through the vaccination clinic, because the attitude of not only the volunteers, but the people that are getting their vaccinations is just remarkable. So I'm so thankful for that. I'm also thankful for United and their effort. Last week, as you know, they ran 3 separate clinics. They'll be running one tomorrow. Those are targeted at portions of the community where people would be described maybe as underserved. They might have more difficulty getting to a mass vaccination site at the Civic Center. So we want to bring the vaccinations to them. And it's good partners like United that allow us to do that. So I'm very thankful for that. I'll pause and just make sure I express my words of empathy for families who have lost loved ones. Even though our COVID experience is better today than it was a month ago, it still is having an impact on our community, on families, on our loved ones, on our businesses. And we work every moment that we're awake, every day, to restore the health of this community, preserving both lives and livelihoods. I'm so thankful to be in Lubbock, Texas. I think we're in the best spot we could be as we continue to work our way through this pandemic. Lacey, back to you.
Thank you, Mayor, and thank you to our panelists. I'm going to ask everyone to turn on their cameras and unmute while we open it up for media questions. Today's media question order is Christy Martinez Garcia with Latino Lubbock, Alyssa Tellez with KLBK, Matt Dotre, the Lubbock Avalanche Journal, Karen McKay with KCBD, Olga Aguero, El Editor, Emma Sipple with the Daily Toreador, and Matthew Stell with KMAC. So let's start with Christy Martinez Garcia.
Good morning, everybody. Dr. Cook, today the Centers for Disease Control and Prevention released new research that found double masking offers more protection against COVID. In a community that some folks have resisted mask wearing altogether, what are your recommendations and thoughts on double masking?
Thanks, Christy. In this particular case, more is better. As you know, a N95 or a KN95 mask is better than a regular cloth filter, is better than a surgical mask. So all that does is increase the barrier for the virus to get out of you or for you to inhale. That's dependent to make sure that it's sealed well around the sides of your face. It fits tightly over your nose, not under your nose, but over your nose. It's just a second layer of a physical barrier that the virus can't get in or get out. It works, absolutely.
Absolutely. By the way, Lent's Excellence dark chocolate with chili, infused with chili is what I recommend, and you can get it at Market Street.
I can't do it with bacon. I've heard it with bacon. I want my bacon separate from my dark chocolate.
I agree.
Lots of Valentine's Day advice today. I'm taking notes. I'd forgotten it was this week.
Yeah. Oh,
Yeah.
you're gonna be in trouble, Mayor. Mr. Purser, thank you for being here today. I wanted to know a little bit, and thank you for extending the vaccine to underserved areas. But my question's a little bit twofold. And first of all, we have had some folks from those neighborhoods, or let me just rephrase that. We've had people that are not from those neighborhoods coming to those stores. How are you connecting directly with folks in those particular zip codes or area of the store location?
Yeah, thank you for the question. First and foremost, we're trying to connect with, through our pharmacy teams, directly with those guests that are in the store on a routine basis. Those would be the first connections we've tried to make. In addition, we've asked for folks to reach out, go to our website, sign up basically for more information and vaccine availability. And then we've leveraged our call center to be able to contact those guests that are on those lists to try to schedule those appointments as the vaccine becomes available.
Thank you.
Okay. Thank you, Christy. Now we move on to Alyssa Tellez with KLBK. Alyssa, can you hear us?
I can hear you guys. Can you hear me?
Yes.
Okay, perfect. Okay, so my first question is for Mayor Pope. Mayor, are people still requesting permission or permits for the cities to have gatherings of more than 10 people? And have any been approved in the last few weeks?
Good question, Alyssa. I think we talked a little bit about this last week too. I'm not sure we've approved any in the last several weeks. This time of year, we don't have that many outdoor gatherings. Remember that the mayors and county judges around the state only have a responsibility on outdoor gatherings. And so as the spring comes and we start to see more of those type events, then we'll get to look at those. I mean, you would think softball tournaments, baseball tournaments, soccer tournaments and the like, and other outdoor events. But the process remains the same. It's the governor's order has not changed in that regard. And we stand ready to help folks have safely hold those events.
All right, thank you, Mayor.
Thank
And
you.
then thank you for my second question. Now that almost 30,000 people in Lubbock have been vaccinated and more than 5,000 have the second doses, have there been any cases yet when someone has gotten both doses of the vaccine and has gotten COVID after that?
Alyssa, I know of none thus far.
Okay, thank you.
Thank you, Alyssa. Now we have Matt Dotre with the Lubbock Avalanche Journal.
Good morning, everyone. Tim, thanks for being here. I kind of want to ask you about these outreach clinics. So, okay, so you kind of have a call center that is, I guess calling people for appointments. So are they specifically targeting people in those zip codes where those outreach clinics are? And is there any kind of walk-up vaccines? I feel like walk-ups would be pretty effective as well in those areas.
Yeah, Matt, thanks for the question. We are definitely targeting those folks that have contacted us from those areas and really have scheduled every dose that's been available to us. And that makes it tough for walk-ups. So we're trying to schedule every single dose that we get access to make sure that we have every dose getting into an arm.
For sure. Right. And, Ms. Wells, I just feel like there's, and this is probably a question for the federal government. I just feel like there's not much advertising. When I think of huge mass vaccinations, I feel like there should be, ads on TV, on billboards, on buses, and just this huge advertising blitz that I feel like we're not seeing. So, how is the city reaching everybody to tell them about these vaccines? And is that possible?
Yeah. And I think we will see more of the media blitz and more information out there when we move to general vaccinations. Right now, it's very targeted. We're still trying to make sure that we get those 1As and 1Bs. And a lot of that information's going out to providers, some targeted Facebook advertising now, the press conferences. We're still seeing the uptake at that clinic is very high. It's being filled with those 1As and 1Bs. And when that slows down, we will then begin to outreach those communities that have not accessed the clinic yet.
Okay, very good. I may sneak in one more question, if that's okay. Tim,
well, Matt, hang on, let me answer. We have more coming in the coming days. We'll have more information coming out, but we will be employing more options to get that information out. We have community partners, and we will have billboards, and there will be a more varied approach coming in the next few days.
Absolutely. That's great. Lacey, thanks. That question should have been for you. Thank you. So Tim, I'm assuming you're getting your vaccines from the health department. So Catherine, is there kind of going to be, I know the city likes the hub and the Max Vaccine Center, but is there kind of going to be a switch maybe to more of these outreach clinics when it comes to balancing the vaccine distribution?
Yeah, it's going to be a mix, Matt. our goal is, I mean, we're getting right now 5,000 doses a week. The most efficient way to get that done is through the Civic Center clinic. There's no way to get that volume done. And we really want to use these community partners such as United to reach some of those people that might not feel comfortable coming into the Civic Center. And we're going to see a change. I mean, this is to get the whole community vaccinated. The health department can't do that on our own. We need to move vaccine into our pharmacy partners. We need to have more access at our doctor's offices. And I think over time, as we see more volume or more availability of vaccine, we're going to see that change.
Matt, think about supply of vaccines like a hockey stick. We're still down on the blade. It's pretty flat. You know, we've seen a little increase, but it's pretty flat. It will start to really take off when we see the Johnson & Johnson vaccine approved, which is likely, as well as more doses of both of Moderna and Pfizer.
Okay, thank you, Matt. Now we have Karen McKay with KCBD.
Well, Matt asked 3 questions, and I'm just going to ask one, so that'll balance things out, okay?
Matt owes you one.
My question, I think, all right. Dr. Cook, you'll probably want to answer this, that some people have been told to take a pain reliever before and after the vaccine to help avoid side effects like fever and chills. But then I've also heard not to do that because on the flip side, that could diminish the effectiveness of the vaccine. So what are your thoughts on that?
You know, I think if you can get by without it, I think that that's okay. I think though, if, you know, some people have a pretty good headache and pretty good fever and a pretty good muscle pain, myalgia is a fancy word for that. I think if those are fairly debilitating and it's really making you miserable, it's okay to take a little bit of Tylenol or Motrin or Advil or leave one of those. I think it's fine.
But I guess my real concern is reading that by taking that after the vaccine, that you could diminish the effectiveness of it. Could that be possible?
Theoretically, it is possible, but our immune system's pretty good. Even though if we put a little wet lid on the top of it, I think you're going to have enough immune response that most people are going to do just fine, whether or not they take Tylenol or Motrin. Either way, so it would be fine. If you can avoid it, try to avoid it. But if you're completely miserable, please take some. I don't want the side effects to keep you from, and if you have a bad, not a bad reaction, but if you're fairly symptomatic from your immune system kicking in, I don't want you telling somebody else you shouldn't go get it. So please medicate yourself if necessary, because it's much more important to get the vaccine than to avoid the vaccine.
Okay, I lied. I want to ask one more. You find the people who actually had COVID first are getting more reaction to the vaccine?
There is some evidence of that if you had COVID, especially a recent COVID within the last several weeks, and then you go get your vaccine down the road, some people have let's call it an exuberant response. Some people don't get it much of a response, but some people, there is some evidence that people have a increased reaction to the side effects.
Okay. Thank you.
Thanks, Karen.
Karen. Okay, next is Olga Aguero. Okay, Olga, are you able to ask questions right now? Okay, she asked me just in case to read her questions. So I will be asking these for Olga Aguero with El Editor. Collection Sites, a wholly owned subsidiary of Medivol, formerly QuestCap, is beginning to roll out new mobile COVID testing cubes across the state in an effort to provide faster and more accessible COVID testing to curb the continued spread of the virus. Would this be something coming to Lubbock?
Catherine, you want to talk about that?
I think we have a really great partnership right now with the TDM testing sites. And I think they're accessible throughout the community. And right now, I think that's going to be our direction.
Okay. And the second question is about vaccines. What is the consideration for having vaccine clinics at different times for those that are unable to attend during working hours or during the day while they are working at home, or having the vaccines available to those underprivileged neighborhoods in Lubbock while working at home or without internet access, or to accommodate their loved ones which are more vulnerable? How can Lubbock help in this area?
Yeah, so I think we've answered some of those questions already. It's a great question. It's something that's very much top of mind for us. You can get your reservation on the internet using Select a Seat, or you can do it via phone. We are open tomorrow. Thursday is our late clinic. So on Thursday, we don't start until 2 and we go until 8 in the evening. And then on Saturday, for the second week in a row, we'll be open on Saturday. And I believe, Catherine, confirm if I'm right, that's 10 a.m. to 3 p.m. Is that correct on Saturday? So we're trying real hard to figure out when best to offer these very important services.
Thank you. Now we go to Emma Sipple with the Daily Toreador.
Hi, so my question is, how will the city balance the lessening economic restrictions due to the lower hospitalization threshold and still keeping cases down and keeping people safe?
Well, we're going to continue to message how important it is to follow our safety protocols. Wear your mask, keep your distance, wash your hands, hang out with the people you've been hanging out with. We are we're cautiously optimistic. Tech students have been back 3 weeks this week, and we've watched for bumps in our numbers, and the distribution of new cases is still very similar to what we've seen for the last 6-8 months, but there's just fewer of them. And I think that proves probably several things. The vaccines are helping. There's some immunity among those that have had it. And maybe most importantly, people are taking this seriously. And that's what we need to continue to do. Masking works. It's painful. I wanted to rip my mask off last night and yell at those officials that I still think flew in on the plane with the West Virginia team. But I couldn't do it. It's just where we are now. We've got to sort of suck it up and get through this.
Sorry, Emma, I cut you off.
Oh, I was just going to say that's all I have. Thank you.
Okay,
Thanks, Emma.
thank you. Sorry. Okay, and last but not least, we have Matthew Still with KMAC.
Thanks, Lacey. 2 quick questions and I'll be done. My first question is about testing sites, and this is probably for Catherine. With less virus in the community, like you said, will we start to see any of those testing sites start to maybe close down, or still have those available until whenever?
I would like to see those testing sites open. I believe we're continuing to get support from TDM to keep those sites open. It is an important asset as we work to control the spread of this disease. People have to have access to that testing.
Gotcha. And another one for Tim Purser. Tim, thanks so much for being on with us. You mentioned underserved communities, and you kind of mentioned what you guys are doing to make sure those communities do get served, specifically North Lubbock and East Lubbock. Anything else that United and possibly the city is doing to make sure that those communities get served when it comes to the vaccination clinics outside of them just being available there?
Yeah, Matthew, thanks for the question. Our footprint with Lubbock, with United is allows us to help cover multiple areas of the city. And so, pharmacies in general have really become kind of an immunizing spot, whether it be flu vaccines or other ancillary vaccines. And so our goal is to just extend that comfort level to those areas where we already have a presence and a footprint, and allow access for those guests to come into our stores where they're used to coming at extended hours and get vaccine when available. So really it's about availability and accessibility for us to those guests.
Matt,
Good to hear.
I'd like Catherine to add to that. We've worked hard on, there's some other vulnerable populations that we've worked locally and with the state to reach out to them. Catherine, could you give a little bit of color on that, please?
Yeah, we are definitely working on starting to set up some pop-up clinics or areas where we can target a small group of individuals that for some reason or another cannot come to the Civic Center Clinic. One of those targets right now is some of our retirement communities. We sent, fire and partnered with a home health agency to ensure that some people that weren't mobile to come to the clinic could come into the or could get vaccinated, and we're going to continue to work on some of those outreaches in the upcoming weeks.
That's good to hear. Thank you.
Thank you, Ned. That concludes our news conference for this week. Thank you to our panelists, thank you to our interpreter, and thank you all for joining us. We hope you have a good week, a happy Valentine's Day, and we will see you next time.